Well, the latest we've heard is a statement from the Department of Health, and this is coming from Professor Chris Whitty, he's the Chief Medical Officer. He says a further patient has tested positive for coronavirus, which, as we know, brings the total number of cases in the UK to 3. Quite telling, the individual did not acquire this in the UK. The patient is being transferred to a specialist NHS centre. I'll tell you more about those in just a second. And we're using robust infection control measures to prevent any possible further spread of the virus. And it goes on to say the NHS is well prepared to manage these cases, and we're now working quickly to identify any contacts the patient has had. That is the key. That is exactly what doctors, clinicians, and anyone else involved in treating this patient will be most concerned with. Obviously, the patient's health is the priority, but they will now be working backwards to see just how much or who has come into contact, close contact. This has to be close proximity contact, not just someone who's been on the same bus or the same coach or the same plane, but somebody who has been in close personal contact with a patient. They will be trying to make that connection, those links there, and working backwards to see who this patient has been in contact with. Those treatment centres. There are 5 specialist treatment centres that we know about that can treat these coronavirus patients. They have specialist teams and they are well equipped to deal with this. There is one in Newcastle, 2 in London, 1 in Sheffield and 1 in Liverpool. So it's possible that this patient has been taken to one of these centres for treatment.